Vitamin D is a fat-soluble vitamin that is essential for a variety of bodily functions. It helps the body absorb calcium and supports healthy bone growth and maintenance. In addition, it plays a role in maintaining a healthy immune system, muscle function, and overall health. There are two main forms of vitamin D: vitamin D2, ergocalciferol, and vitamin D3, cholecalciferol. Vitamin D2 is produced by plants, while vitamin D3 is produced by the body when the skin is exposed to sunlight. Sources of vitamin D: the primary source of vitamin D is sunlight. The body can produce vitamin D when the skin is exposed to sunlight, but the amount of vitamin D produced depends on factors such as skin color, geographic location, and time of day. Foods that are high in vitamin D include fatty fish, such as salmon and tuna, egg yolks, and fortified foods such as milk and cereal. Vitamin D supplements are also available and can be a good option for people who are unable to get enough vitamin D through sunlight and diet. Vitamin D deficiency. Vitamin D deficiency is a common problem, especially among older adults and people who don't get enough sunlight. Symptoms of vitamin D deficiency include weak bones, muscle weakness, fatigue, and an increased risk of fractures. Severe vitamin D deficiency can lead to a condition called rickets in children and osteomalacia in adults. The only way to confirm if you have a vitamin D deficiency is by getting a blood test called the 25-hydroxyvitamin D test, also known as the 25-OD test. This test measures the level of vitamin D in your blood. The normal range for vitamin D levels in the blood is usually considered to be between 20 to 50 nanograms ml, nanograms per milliliter, although some experts suggest that levels above 30 nanograms per milliliter are optimal for most people. Benefits. Vitamin D and bone health. One of the most well-known benefits of vitamin D is its ability to support healthy bone growth and maintenance. Vitamin D helps the body absorb calcium, which is essential for bone health. Without enough vitamin D, the body can't absorb enough calcium, which can lead to weak bones and an increased risk of fractures, especially in older adults. Vitamin D and immune system. Vitamin D is also important for supporting the immune system. It plays a role in regulating immune function and helps the body fight off infections and diseases. Studies have suggested that vitamin D deficiency may increase the risk of respiratory infections, such as the flu and pneumonia, and autoimmune diseases, such as multiple sclerosis. Vitamin D and mood. There is also some evidence that vitamin D may play a role in regulating mood and reducing the risk of depression. Some studies have suggested that people with low levels of vitamin D may be at an increased risk of depression, and supplementing with vitamin D may help improve symptoms in people with depression. Vitamin D and cancer. Some studies have suggested that vitamin D may have a protective effect against certain types of cancer, including breast, prostate, and colorectal cancer. However, more research is needed to fully understand the relationship between vitamin D and cancer. Vitamin D and pregnancy. Vitamin D is important for pregnant women and their babies. It helps support healthy bone growth and development, and some studies have suggested that it may reduce the risk of preterm birth and preeclampsia. Pregnant women should talk to their healthcare providers about their vitamin D needs and whether supplements are recommended. Vitamin D and kidney disease. People with kidney disease are at an increased risk of vitamin D deficiency because the kidneys are involved in converting vitamin D to its active form. In some cases, people with kidney disease may need to take vitamin D supplements to maintain adequate levels. Vitamin D toxicity. Although rare, it is possible to consume too much vitamin D, which can lead to toxicity. Symptoms of vitamin D toxicity include nausea, vomiting, weakness, and kidney damage. The safe upper limit for vitamin D intake is 4,000 IU per day for most adults. So, vitamin D is a crucial nutrient that plays a variety of roles in maintaining overall health. It's important to get enough vitamin D through sun exposure, diet or supplements, and to talk to a healthcare provider about any concerns regarding vitamin D intake or deficiency. Thank you for watching. Please subscribe the channel.